Hi, I'm Dr. Matt Michaels, Senior Vice President of Behave Health. I'm going to talk to you today about my nonlinear path to where I am today as a healthcare executive. What I do today is quality and compliance for healthcare facilities. And a piece of advice I was given when I was kind of trying to decide between clinical and research was to do research, and then you can always do clinical. If you do clinical for graduate school, you're pretty much limited that you're not going to be as not going to have as many opportunities to do research later. That's what I did. I did a couple undergraduate research opportunities, and having those undergraduate research papers really helped me get into the school of my choice for graduate school in a fully funded Ph.D. program. I wanted to go back to academia initially. That was my 5-year plan, was to be a research professor at an R1 university. And I got my letters of rec lined up. I had the publication record. I had my H index, my I-10 index. All my CV was lined up to do academia as a research professor. And I went to write my personal statement for a great opportunity as a assistant professor at a large university, and I couldn't do it. My heart wasn't in it. I wish that I had been more honest with myself initially, that I wasn't in love with the writing process. But I was honest with myself in that moment. And around that time, I had been helping in my clinical internship, I was helping the quality improvement department to do a suicide risk assessment implementation using the Columbia Suicide Severity Rating Scale. And I really enjoyed that work. Was able to move to another company as their compliance manager. After that, I was promoted to vice president of quality and compliance at that company. They were acquired by another larger company that had over 1,300 employees, 9 figures in annual revenue, and I became their lead, their compliance leader for that organization. I am currently with a little bit of a smaller company that's I'm pretty convinced going to have an outsized impact on the industry. Is one that I'm really passionate about working for. So that's my story, a kind of winding path. The graduate school is definitely recommended if you have an undergrad degree in psych or are planning to get a bachelor's. Do not stop there, get at least a master's. If you want to kind of create more opportunity for yourself, look outside of just the traditional PhD PsyD. Kind of whatever it is that gets you excited, that's what you want to pay attention to. What gets you excited, even if it seems a little out of reach, you're going to do so much better work and be so much more dedicated to whatever it is that you're doing that you're going to be able to overcome any learning curve versus something that you're kind of moderately excited about or not too excited about at all. If you have a 5-year plan, that's great. Don't be rigid about it, is my advice to you. Is kind of leave yourself open. There's going to be opportunities that are totally unknown to you today that might be the next stepping stone to a great career in your life. There's no one size fits all path. You've got to find your path, walk that path. Don't do what I did. Don't do what somebody else did. Do what works for you. Do what excites you.